Hello everyone, myself Dr. Namrata Vithlani. In this video, we will discuss regarding the ventricular ectopic beats or ventricular premature complexes (VPCs). So, what are the common symptoms? They include the chest discomfort, uneasiness, fatigue, palpitation, or dyspnea. Now, what are the common etiologies for occurrence of the VPCs? They include the coronary artery disease or acute coronary syndrome or acute myocardial infarction. Other include the various cardiomyopathies such as hypertrophic cardiomyopathy, dilated cardiomyopathy, or arrhythmogenic right ventricular cardiomyopathy. Then myocarditis, various valvular disorders such as mitral valve prolapse. Now, these are the structural heart disease which contribute to the occurrence of the VPCs. What are other etiologies? Most important is the electrolyte disturbance, that is hypokalemia or hypomagnesemia, and sometimes hypercalcemia. So we should look for the potassium level, serum potassium level in all patients presenting with the arrhythmias, and we should correct it. And we should also look for the magnesium level, because if hypomagnesemia is uncorrected, so it will not allow the correction of hypokalemia, because hypokalemia, it is often associated with the hypomagnesemia. So electrolyte disturbance you should look for in each patient presenting with the arrhythmias. Other metabolic causes that include the hypoxia, hypercapnia, alcohol intoxication, illicit drug abuse, certain drug overdose such as digitalis toxicity, aminophylline, sympathomimetic drugs, etc. So these are the important etiologies for occurrence of the VPCs. Now, why we need to be cautious? So why we need to treat the VPCs? Because VPCs on a long run, if the VPC burden is high, if we look with the 24-hour Holter monitoring, and the VPC burden in 24 hours contributes to more than 10% of the heartbeats, over a period it can lead to the cardiomyopathy or LV dysfunction. So it can precipitate the LV dysfunction, it can lead to the occurrence of the cardiomyopathy over years. It can also precipitate the occurrence of the heart failure, can also increase the risk of sudden cardiac death. And if VPCs are multiple, frequent, it may also trigger the life-threatening arrhythmias such as ventricular tachycardia or ventricular fibrillation. So we must be cautious in all patients with the VPCs. Thank you.